Children, Young People and Adults Health and Scrutiny meeting. This is our opportunity to review and comment on the revised budget before it goes before Cabinet and Council. Before we begin, may I remind you all to mute unless you're addressing an item, and raise your virtual hands should you wish to speak at any point in the meeting. So the agenda proper. First of all, apologies. Do we have any apologies, Jo?
Thank you, Chair. Yes, we do. We have apologies from Councillor Cross, Councillor Webb and Councillor Burrows. We have Councillor Waller in attendance for Councillor Burrows and also here in her own right. And yeah, I need to find out what's happened to Councillor Baines, but apart from that, that's...
Thank you. Hopefully Councillor Baines is just having some difficulties with IT. Next, we'll move on to declarations of interest. Have we any interest to be declared this evening? I can't see any hands. I'm going to declare an interest in respect of item 5, Appendix P, which is CHI 015. I'm the treasurer of Rutland Conquerors basketball team, the basketball team mentioned in that item. If the committee agrees, I will facilitate the debate when we come to that item, but not take part in any discussion with it, if everyone is okay with that. Not seeing any issues. Thank you. So
Councillor Beggy has his hand up.
Oh, sorry, Councillor Beggy, sorry.
I don't know if it's appropriate, but I have to declare that I am the owner of a youth, but it won't influence my discussions.
Thank you. I think Councillor Rozelle and myself can also claim to own a youth as well. Of this age group, so we will join you in that declaration too. And moving on, if we go to petitions, deputations and questions, Jo, have we got any?
No, none have been received, Chair.
Thank you. And do we have any questions with notice from members?
No formal questions with notice, but I know there were questions raised at the pre-meet, and these will be addressed at the meeting.
Thank you. Now we go on to item number 5, the budget savings for 21-22 for the main item on the agenda. Sav, I'll hand over to you at this point. We also have Councillor Payne, the portfolio holder for finance, and Dawn and John, the directors for children and adult services, in attendance to answer our questions. So Sav, I will move over to you, please.
Thank you, Chair. Just wanted to say a few words by way of introduction. Members will recall that at February Council we approved a budget for 21-22, and we approved a budget that had a £2.4 million gap, a gap that was propped up by use of general fund and earmark reserves. And of course, as I said at that time, that's not good practice, and that's something that we can't do indefinitely. We have to live within our means. And we said at budget time that we would go away in the first instance as officers, go away and look to see what we could do to reduce that gap. And that's something that we've done. We said at that time that we'd try and reduce that gap in year to £1 million. That was sorry, by at least £1 million. That was the target we set ourselves. I have to say it's been a really difficult start to the year, as well as the budget. Obviously, a lot of officers have been continuing to be involved in our pandemic response. And we've had obviously some massive things to deal with, like the HIF. And there are quite a number of big projects underway in relation to leisure and waste management. It really has been a really, really busy start to the year. Notwithstanding that, we have been able to look through the budgets and generate some ideas. So I'm pleased that we've been able to do that. As I say, I think it's been really challenging. The outcome of that exercise that we've undertaken has identified about up to £2.4 million worth of potential savings, and they are set out. The table in the report sets that out. So if we delivered everything we said, we could save up to 2.4 million. That's what that's saying. I mean, that is an estimate, as I'm sure members will appreciate. There is a lot of work to do before we get to that place. I think the key thing to note is that, would that be enough? So if we delivered everything we'd identified, would it be enough? And the reality is, I'm afraid it wouldn't. Our gap in future years grows. It's next year we're looking at £2.7 million. And of course, as we all know, we are very likely to get further pressures on our budget. Could be social care demand, could be around housing, could be anywhere. So we are likely to get further pressures on our budget. So we've started a process. We've generated some ideas, some of which you have in front of you tonight. Others are projects that we need to work on over this year and beyond. The key for this year, for 21-22, is to deliver on those things we have identified in the short term, progress other projects, and of course, manage our budget effectively during 21-22 to try and minimise cost as far as we can. What we have in front of us tonight, in particular, are some short-term options for us to revise the budget pretty quickly that would go towards reducing our financial gap. Obviously, the report also signposts some medium and longer term projects that we need to start, some of which we already have. One of the things that we need to do as a management team is to look at what we can do to accelerate some of the projects that were identified in the report. The reality is our capacity is stretched because of the pandemic and because of other projects that have started. So whilst I would love us to be able to start lots of new projects tomorrow, I don't think that would be the best idea. I think if we're going to do things, we need to do them properly. And I do think at this moment in time, our capacity is really stretched. Some of you will have no doubt noted that in the report, one of the things that I'm minded to ask of Cabinet and Council is to delegate some resource to us that would allow us to bring in external support. And whilst I believe that's the right thing to do, at this moment in time, I wouldn't sanction bringing in any external support at the moment, because one thing I think we've learned in the past few months is that if we're going to bring in external support, we still need capacity to lead, to manage, to direct that support appropriately. And that is challenging even when we've got limited capacity. So one of the things we need to do as SMT is to go away and think about what can we do to accelerate some of the work. We are, of course, still trying to aim for a target of reducing the budget deficit by £1 million for 22-23. But there are going to be risks in doing that. Clearly, we don't know what our funding settlement will be for next year, and we do know there are pressures emerging, some of which are highlighted in the report. So I think at this moment in time, I think we're doing as much as we can. I don't feel massively confident that we'll achieve that target as it stands. I think that's going to be very, very challenging. Why is that important? Well, it's important because that's the target we've set ourselves, to stop resources depleting too quickly. But I think for members, it's equally important because my wish is that every spare bit of capacity that officers have, they focus on work that's reduced, that focuses on reducing that financial gap. And I hope members will support that, both through the work they do at Scrutiny and other work they might ask officers to do. In terms of the proposals that you have in front of you tonight, then I do think you start to get a sense that they certainly epitomise some of the principles that we've talked about in the report. So when we look ahead, the council will be a smaller council in terms of spend and in terms of what we do. Whilst we might be smaller, our focus will invariably be on providing high quality services, albeit it might be less of them. We certainly are going to expect people to do more for themselves in the future. I think that's a given. And of course, we will be trying to charge for things where we can, and it's the right thing to do. So, you know, we have set a series of principles in the report. I certainly think the proposals we've come up with thus far do mirror those principles we've set out. The final thing to say is, I think, as indicated earlier, I think the chair indicated that this, or a variation of this report, will make its way to Cabinet and then to Council for you to make a formal decision as to whether we revise the budget or not. So this is an opportunity to make any comments that that you may wish Cabinet to take into consideration before it considers the report in May. At that point, Chair, I will hand over for, you know, for substantive debate and any questions. Thank you.
Thank you, Sav. So over to yourselves, colleagues. Would we like to just go through our questions from our pre-meet first, or would you like to move into debate first? How would the panel like?
Deal with the questions first, I would suggest, Chairman.
Okay. Sav, would you like me to read those out for you? And then they be answered by officers? Sorry, Sav, you're on mute.
Yeah. Yeah, if you wish to do that, that's fine, and then we'll pick the answers.
Okay. Sorry, bear with me just for 1 second while I pull them up.
Okay.
Sorry, Joe. Are you able to pull them up? I'm having a bit of a moment.
Yes, I've got them here. I'll just share my screen 1 second. Are you seeing that? Or...
Yes, I am. Thank you. So for everyone, we're into Appendix B and page 14 on the papers. We'll start with CHI 007, which the panel was asking for some clarity around the fees and subscriptions. So I'm not sure who would be, sorry, would this be you, Dawn?
Yes, it would. Yeah.
Thank you.
Yeah. So in terms of the fees and subscriptions, so in terms of CHI 007 in front of you and the savings attached to that, just to be clear, those fees and subscriptions that are part of this proposal are not connected to subscriptions to professional bodies. So when I talk about subscriptions to professional bodies, that would be, for example, Social Work England, which is the regulatory body for qualified social workers, the Ofsted we have to pay a subscription to. That's not what we're talking about here. So the areas of service that are commissioned on an ad hoc basis are the ones listed, which are translation and interpretation services, specialist assessments where, so for example, if we're in court proceedings and the court directs that we are required to complete an independent social work assessment, clearly we have to commission that outside of our own resources, and family group conference meetings. What we're looking at doing is looking at when we do commission those services, looking at reducing the costs and looking at doing them on a more of a bulk buy. I was distracted by the chat. Doing it in more of a kind of bulk buy rather than on an ad hoc basis in the way that we're doing it at the moment. So that's how the cost savings will be achieved.
Okay, thank you. Sorry, Councillor Ainsley.
Thank you, Chair. Dawn, if I could just ask a quick supplementary on that very CHI 007, if that's okay with you?
Yeah.
And Chair, good, thank you. Yeah, you're doing some tremendous work with SEND and actually doing early intervention. Is it likely that this is going to have a significant impact on early intervention, seeing as if you're going to try and plan everything out beforehand?
No, I mean, this budget area is specifically a social care budget area that is specifically, as I said, about translation and interpreting services, independent social work assessments and family group conferences, which is all within the social care budget.
Sorry, thank you. I was mildly confused there. Thanks for the clarification.
Thank you, Dawn. Do we have any other questions relating to CHI 007? Councillor Waller.
Thank you very much, Chairman. Dawn, is there a risk that if we move a contract to a, to put it crudely, bulk buy? I know that's not quite right.
No, it isn't, but you catch my drift.
I caught your drift, yeah. But if we move to a contract like that, is there a risk that we will be paying for a contract but actually not using it in the course of the year?
Well, and that's what we're looking into, because that's an excellent point. So I'll give you an example of family group conferences. At the moment, we buy them individually, and they cost approximately, on average, £525 per family group conference commissioned. If we were to commission, let's say, 10 a year, we would be able to bring that unit cost down. And that's the work that's being undertaken to see if we, in terms of that demand forecasting, to avoid getting into a situation where we do commission, let's say 10 a year and only use 8, and then of course you're not making the savings. So that's the piece of work that's being done at the moment.
Thank you very much.
Thank you. Any others on that? If not, we shall move on to CH010, which is youth services, and the savings of 5,400 seems small compared to the revised offer, and it was just clarification. Is that the amount of an underspend, and is there still budget for the offer? Again, I'm looking to Dawn probably for the answer.
Yes, yeah. So in terms of the youth services budget, the answer is yes, there is still a budget. There still will be a budget. The saving that we can make is because we've actually been reporting a small underspend over the last few years, and some of the revised budget will mean a small reduction in resources, such as kind of graphics, for example, maintaining the water dispenser, or the kind of resources in the youth meeting room. Some of the costs, obviously, and the savings are related to the fact that Jules House remains closed at the moment. So, you know, we don't need to resource Jules House at this time, but it does still mean that we've got sufficient funds in the budget in this year to support the youth offer. So it's more related to the fact that Jules House remains closed at the current time. We've always had an underspend over the last few years of a couple of thousand, so it means that it's a quick win saving without impacting on the youth offer at this time.
Thank you. Councillor Waller.
Thank you very much, Chairman. As Dawn has mentioned, Jules House, I will mention my observation now at this point rather than later, and that is I gather from the way the paper's written that our young people have been supported during the pandemic.
Yes, yes.
Yeah, despite Jules House not being open. Should we not be looking, therefore, sooner rather than later? And I do appreciate it's in the looking to the future, the actual closure of Jules House and doing things differently with much more detached youth work, for example, that type of thing.
Yes, I mean, just picking up your point, I mean, clearly, as you're very well aware, Jules House has been closed for some significant time now, but the youth service has still been operating, but albeit in a different way, but there has still been a youth offer. There is, in terms of the long-term future of Jules House, that does form part of the longer-term projects that are being looked at to make that decision about the long-term future of Jules House. So we're not, and it will be done also as part of the Children's Services offer work as well. So that is still being considered and will obviously be coming through to members as that longer-term project work is completed.
May I come back on that, Chairman, please?
Of course.
Thank you. Thank you for that, Dawn. Given, though, the fact it's not been open, my point, I think, is that I would like us to look at it sooner rather than longer term, because I think we have a real opportunity to do something more quickly rather than more slowly. And I hope, Chairman, that comment gets passed through to Cabinet with your comments. You can make it clear it's just one person making that comment.
Thank you.
Can I just add, Gail, I actually support that. I think that looking at CHI 017, the Jules House Service Review, seems a particularly good time to actually investigate how the services to be delivered to our young people, and indeed whether we actually need that. Dare I describe it as a white elephant? Probably not. But do we need Jules House? So if that's at all possible, Dawn, how do you feel about that? Is that something that's really something that you just, are your resources so stretched you won't be able to investigate, do you think, in good time? Or
no, I mean, just to assure members, the work has already started, so I just want to be clear on that. Sorry. So that review has already started. There's no plan to reopen Jules House at the current time. Obviously, we're still within the kind of government roadmap with all the restrictions, etc. Anyway, but we're not. We've already started the process of reviewing very clearly the corporate asset, which is Jules House, and how we can still continue to deliver our youth services, but in a different way, and actually in a way that our young people have embraced as well. So that's important too.
Thank you, Dawn. Councillor Payne, you wanted to come in. Sorry, Councillor Payne, you put yourself back on mute.
Sorry. Thank you both for your suggestions there. And we are looking at Jules House as part of the property portfolio as well. But your suggestion that it's expedited will be taken into Cabinet for further consideration. Thanks.
Thank you. Just taking a point from Councillor Waller and Councillor Ainsley, I'm not sure, and I'm looking to Councillor Ainsley, whether this is something that Children's Scrutiny separately might like to take up early next year and keep a watching brief on this moving forward. I'm just looking to Councillor Ainsley.
Yeah, that's exactly my thoughts, Sam. I think that there's all sorts of things we at Children's Scrutiny can be considering. We'll need to obviously put that to the committee, but I'm thinking perhaps we get a small working party together or something to assist Dawn in her deliberations. But yet to be decided. We haven't. We've got the annual council meeting coming up, and who knows what changes we may have to enjoy.
Okay, so we'll. Councillor, sorry, not Councillor. Joe, could you make a note of that, please? Thank you. Do we have any further comments on CHI 010 and the CHI 017, which we can come back to later on if needed? No, I'm not seeing any hands up. I just need to just confirm with Councillor Ball, if I'm not sure if he can write in chat or whether he can make us aware if there's anything he'd like to add. That would be great. I'm not seeing anything come up in chat. But if he could alert us if there is anything he'd like to add. If not, we will move on to CHI 015, which and
I think that'll be me again, Councillor Harvey.
It will indeed, Dawn. So it was.
Before you go on to that, did you skip over 11? Did I miss that?
I did. We didn't. It's just because we were going through the questions and we didn't have a question for that one per se. We can come back.
Okay. No, that's fine. Thank you. Thank you.
So moving on to CHI 015. Over to you, Dawn, please.
Okay, so in terms of the question that's been raised, we do have a statutory duty under the short breaks for carers of disabled children regulations to provide a range of short break services. However, there is no prescribed offer that the local authority must provide under those short break regulations. So they are flexible. The service must be able to meet the requirements of carers, however, as the regulations intend. So in relation to the savings that are being put forward, to reassure Scrutiny members, we are not intending at this point in time to reduce the overnight respite breaks for children or young people. If that was to be considered, then we would have to do a full public engagement and consultation exercise, which we would indeed do. So I just want to reassure Scrutiny on that. The savings relate to positive activities. So they're opportunities for children and young people to experience activities outside of their primary carer environment that supports independence and living skills and preparation for adulthood or social skills. And it can be, all sorts of different activities. But it has included in the past a number of residential stays, which actually are very expensive. Clearly in the last year, those residentials haven't taken place anyway because of the pandemic, and some of the savings that are being put forward is that we would instead of, I think there used to be 3 residentials a year, it would go down to 1, for example, and there would be fewer trips out to external leisure sites and more local activities would be provided. So that would be the difference in offer. But to reassure Scrutiny, the saving put forward here does not include the overnight respite breaks that we have in place for children and young people.
Thank you, Dawn. Do we have any comments from members? I'm not seeing any hands. Thank you very much. So now over to ADU 0010. Sorry. I think this I would look to John to answer, please.
Thank you very much, Councillor Harvey. Good evening, everybody. Yes, we do have some sizable budgets in adult social care. This one in particular was the only one that we could actually identify that gave an immediate saving, which was the ask. And this was a bit of a defunct initiative where health staff were being trained in providing care, and care staff, i.e. our staff, were being delegated some health pieces of work because it stops duplication. Now that piece of work has transformed into some other training now and will be absorbed in our integration. Now, if I can just add, if I may, that with the phrase, surely there must be some budget lines where there are savings to be made, either cost or on revised offers. Absolutely. But that's going to take a bit of time. Our offer to save money is what we'll probably have to be looking at, councillors, because our millions that we spend is mainly on our older population, because we have quite a large older population. Keeping that population safe, and it's to their needs. But one thing we are is we're very preventative. So that does leave a little bit of scope, I would suggest, with some very careful consideration and very careful contingency making. A little bit of scope, perhaps, to look at our eligibility, providing it's firmly remains within the Care Act, of course. And I would just add, if I may again, councillors, a caveat to that. I've asked for a end-to-end review of adult social care, which we're just about to launch. And I'm pleased to report, I think that we have managed to secure some free external support from both ADAS and the LGA to give us a little bit of oversight, a bit of dip testing, and to say perhaps where we can tighten up a little bit. But when I mention that we perhaps can become less preventative, this is the caveat, and this is perhaps a little bit of a warning that we need to be watching very carefully, because there's a lot of changes going in adult social care. There's potential investment. And if we start to cut at a time of investment, we could actually start to handicap ourselves. So we've worked preventatively, and we are the best in the country. We're told that we're one of the most cost effective, if not the most cost effective in the country, because of the way that we work. And I believe it's our prevention offer that's done this. We did that because the Care Act asks us to do so. We've just had the Health Integration and Innovation Bill, which gives us the ICSs, the integrated care systems, which tells us to be preventative with our partners in care. There's opportunity for investment there because we could potentially become a provider. Adult social care could become a provider, and I'm in talks actively about that. The other area is, of course, and is the very, very long pending adult social care bill, which we promised yet again will come out in November. That is a vitally important piece of legislation for us, which gives us a steer as to where we will be. There could be money coming with that. There could be. We also have to be balancing our pressures. Now, Sav mentioned pressures in his opening address. We're going to have to put together a 7-day-a-week service. That's something that's going to cost us. We are looking for external investment in that, and we've had a little bit of success. So I think that we can make a change. I think that we can change our offer, but it needs to be a little bit like an oil tanker. We need to steer her carefully in the right directions, and we need to avoid the whirlpools and the rocks as we go, and watch the lighthouse firmly in front. Do forgive the analogy. I got a bit carried away there, but it did the trick, I hope. Thank you.
Thank you, John. Members, any questions on that? Councillor Waller. Oh, sorry. Shall I, Councillor Waller and then Councillor Ainsley after, please, and then Councillor Rizal.
I'm happy to go after Councillor Ainsley.
Oh, that's very kind of you. I will take your offer. I'm guessing, John, that there's so much work to be done in actually identifying the changes that when I look at the longer term projects in Appendix E, the other ideas, that, you know, we've just got 2 items in there. I'm guessing that your reviews will be looking to significantly increase the number of ideas and offers that are going to be, and that'll come out in the fullness of time. Yeah, you're nodding away furiously. Great. So that's what I wanted to hear. Thank you, John.
Yeah, we have a lot of ideas, Councillor Ainsley.
Yeah, I know you would have. It's just that they're not in this paper. That's great. Thank you.
because I can't.
Councillor Waller and then Councillor Rizal.
Thank you very much. My first comment, or it's a request really, which Chairman, with your indulgence, I'd like also pass through to Cabinet for their deliberations. And that is, in these first 1, 2, 3, 4, 5, I think it is, the children and adults potential savings, what we're not, what's not being suggested to us is how we compare with other authorities in terms of the offer that we give. So we don't really know whether we're cutting something where we're giving less than other places already, or whether we're running the Rolls Royce and everybody else is in the Mini, if you'll excuse the phrase. And I think if we are going to be making decisions about budget, not just now, but in the future as well, we do need to have, in terms of service levels, some comparisons with other places. So can I ask that that gets included going forward? That's my first comment on this section. And my second is, are we absolutely confident that the early intervention stroke children's centre services are actually meeting those whose needs are greatest? Or is it just meeting the needs of those who in the past, for example, lived in Oakham, so could get to the children's centre easily? And I think in any service review, that needs to be part and parcel of the review. I don't expect comment now, because obviously this is going to be an ongoing process, but those are the 2 points I wanted to raise in relation to that section. Thank you very much.
Thank you, Councillor Waller. We'll go to Councillor Rizal and then Councillor Beggy, and then I'll briefly ask Dawn to come back in afterwards on that section around the children's centre. But we'll go to Councillor Rizal.
Yeah, thank you. The question's for John, actually. John, if I'm right in saying you mentioned the primary care network, and my point in there is that we're talking about collaborative work across the organisation. I think the understanding is that any work that comes through the primary care network is funded. So as a council, we would not be expected to fund that work. That would come from the CCG. And then in real terms, there wouldn't be a risk to our own funding, but there might be a way of providing services collaboratively, which could in fact save money in social care. Is that reasonable?
Exactly right, Councillor. And that's what we're looking at, and that's what we're working with our partners.
Thank you, Councillor Rizal. Councillor Beggy.
Just a quick one, John. You mentioned potential new legislation and government requirements towards the end of this year. Will this potentially not add new burdens to your funding?
Councillor Beggy, what a great question. We've been waiting for this piece of legislation for years. It's the one that's going to cure all the ills of adult social care. I can't answer any question about it. I can't find anybody that's even dare speculate what might be in it. The optimist in me, and I underline the word optimist because as those who know me know I am an optimist, is hoping there's going to be some quite radical suggestions in there, and that there is some funding come with it to back up the requests in the Health Integration and Innovation Bill, because to me that would make sense.
Thank you, John. Councillor Beggy, would you like to come back, or is that okay? Councillor Bull, can I just check with a thumbs up? Do you have any questions till now, or you can speak to us?
Thank and apologies, Chairman. I'll have to drop the laptop back into Catmas tomorrow. I've transferred to my own computer, so I've been listening to catch up, but I'm broadly in line with the comments made by councillors so far.
Thank you, Councillor Bull. So I'll come back towards the end to the Councillor Waller's comparison to other LAs, but I didn't know, I would just wanted to give Dawn the opportunity to make comment on the Children's Centre if she wanted to.
Yeah, I can, and actually, I think it's a good point in terms of the reach of the children's centre as it used to be, and what we've learnt over the last year in terms of what it can be and should be, in terms of broader reach across the whole community. What we've learnt in the last 12 months is actually we have been able to be much more focused in terms of our offer to children and families. But what we've also been able to do is by the use of technology and virtual groups, for example, is that parents have actually really welcomed the use of technology and the virtual groups and the input that they've had from the Children's Centre via Zoom, for example. And we've also used recordings so that they can access it at times that are good for them as opposed to good for us when we want to offer the service. So there's lots of learning actually that's been really valuable that will translate into a different way of us offering a children's centre service. But the intention of the children's services offer work, which is the kind of larger strategic project across the whole of children's services. One of the principles is about looking at making sure that we are offering the right level of service to the right families, and that we're focused in terms of the services that the council offer, but equally that we expect more of our partners than perhaps we have done in the past, and that we require and build a more of a community infrastructure around our families, so to negate the need for them to escalate into council services. So that's part of the bigger piece of work, if you like.
Thank you, Dawn. Councillor Waller, would you like to come back? If not, I'll bring Councillor Wilby in.
No, I'm happy. Thank you, Chairman.
Thank you. Councillor Wilby.
Thanks, Chair. All I'd like to say is that sometimes it's very difficult to get a really subjective, real world view of what goes on in children's centres and things like that. It's very easy to read the documentation, but if anyone wants to come and sit in, and at the moment we're doing it virtually, then I would be delighted to welcome you to come in and listen to the Children's Centre meetings when they come up, because they are across the board utilising all the people who are partners in it. And I think you'll find it a very useful forum. And if you have any wonderful ideas, then we'd be willing and very glad to receive them as we go forward.
Thank you, Councillor Wilby. Councillor Ainsley.
Thank you, Chair. I just really wanted to ask Dawn, what was the progress of the research project? I noticed that you're planning to reduce open access to universal services, which seems quite a sensible thing to become more targeted. But you also go on to mention the research project. What progress are you making on that so far, or has it started? Or
yeah, it's only just started. Okay. So it's in a very embryonic, but so it's in its very early stages. But what the plan is that the first phase will be completed in terms of kind of, you know, a review of the effectiveness, but actually that it will be a 3-year research project to talk that will revisit the outcomes a year on year for 3 years, so that we actually make sure that we're making sustainable change within children and families' lives. But it's literally just started, so I haven't got anything to report just at the moment.
Look, thank you very much, Nick. Can I come back with a quick supplementary, if I may, please, Chair?
Of course, Councillor Ainsley.
Yeah, I certainly wasn't expecting a report, Dawn. I realise there's been a tremendous amount of work put into this, and but I think 20k savings is substantial savings to be made on that service, isn't it? And I just thought we don't want to be undoing the work that you're making in the savings as a result of the research project, but you've already identified that that's not going to be happening because you're very cognizant. No. Yeah, okay. Great, thank you.
We're very comfortable with that £20,000 reduction in terms of the service offer.
And that's primarily, I guess, by reducing the universal offer to all.
Well, it's partly reducing the universal offer, but it's also partly to do with the different way of delivering services. So not doing everything face to face, for example, having much more of a hybrid model, moving for, to make it a more sustainable model for the future. So there's different elements, but actually the £20,000 reduction we don't feel will impact adversely on our service offer.
And that's primarily because of the, well, a good thing to come out of COVID then, you're actually doing remote access, so that's great.
Yeah.
All right, thank you very much.
Thank you. So that ended our questions around our little sections on Appendix B. Does anyone have anything further to add on Appendix B before we move on to the longer term savings? Councillor Powell.
Thank you, Chairman. Okay, I'll save my question on the longer term one to later. I think obviously officers have already had a lot of detailed looks at their budget, which is fantastic, and thank you for all the details provided. That's appreciated. And I think that's a useful list. Obviously for adults and children we had quite a small number compared to the other scrutiny committee. I think what I was wondering and struggling with a bit, and I don't know if that's possible when it comes to cabinet, we've got quite a few savings where it says, you know, no impact. I mean, obviously officers on a day-to-day basis are looking to save money by commissioning things in a different way, and that's just normal, you know, day-to-day operations, which I don't think members need to get involved in. But there's some that, you know, and if there's no impact and we've saved money, that's great. Equally, I don't think we necessarily need to get too involved. But I was just wondering if there's a way of structuring that where in terms of some sort of grid in terms of what, you know, whether it's a nil impact, whether it's a reduced service offer, or whether it's a policy change. Because I think you know, we can trust officers to do their job, but I think we need to be absolutely clear which are the ones that are making significant changes to the actual service. And I see in some of those there's a bit of, not just on children's and adults, but there's a bit of a overlap between what's, and somewhere we've, you know, saved money on the budget in the past, so therefore we've underspent, so therefore we're okay on this budget. There seems to be a bit of an overlap between what is an impact and whether it's actually a reduced service. I don't know if I'm making myself clear. I just find it quite helpful if there was a bit of structure on those changes. Does that make sense to somebody?
I think so. Are you asking, just to clarify, are you asking whether we can have an additional grid, so to say, whether there's a loss of service or whether it's an in-house in kind of in budget saving, so to speak?
Yeah, I think the danger of going down the list is that members get very involved in operational issues, which we actually don't need to, and we really need to concentrate on the significant issues of policy and significant revised offers. So I was just wondering if there was a different way to, not extra information, but just to present that in a way that would make it easier for members to actually hone in that sort of way.
I'll admit I'm still slightly confuddled.
Okay, do you want to, I mean, this might be just my personal opinion because everyone else is looking blank, maybe just the way my brain works, but I'm quite happy to talk to someone afterwards if that's helpful.
If I could suggest, that may be the best thing to do, Rosemary, because it seems quite a substantial. I think I know what you're saying.
I'm not talking about a substantial change. I'm just talking about the structure of these recommendations from a member's perspective.
I think Beth's taken offline, I think.
Yeah, okay, thank you.
Councillor Ball.
Yeah, no, just to support that, Chairman, I think what Rosemary is really saying is if you like, there is quite a difference between what I would term the day job, where, you know, our professional and highly competent officers need to do that. And I think, therefore, they have to have that degree of ability to actually make those decisions. But I think what Councillor Powell is saying, therefore, we are looking more at the big picture, and I would support that. That is there's no criticism intended there whatsoever. But I think that is perhaps what Councillor Powell is just saying, that we need to make sure that we're not fettering our officers in the areas of their expertise, where we are obviously well-meaning and really intended as councillors, but we're not the experts. I don't know whether Councillor Powell will nod to that, but that would also be my view, for if that's helpful, Chairman.
Thank you, Councillor. Sorry, thank you, Councillor Ball. I think hopefully you've clarified it a bit, but yeah, that's what I was differentiating between operational and actually members' responsibilities.
Absolutely, thank you.
Thank you. I'll bring Sav in first, and then Councillor Rozelle.
Yeah, okay. In relation to Councillor Powell's comment, I mean, clearly, Appendix B is called Revision to Council Offer, and that is deliberate because it means that the offer is changing as a result of the proposals we're putting forward. Now, in some cases, people are saying, well, there's no impact, that can be managed, but that doesn't change the fact the offer is actually changing as a result of the changes we're making. So that's why we put everything together in an appendix in that way. And it's why we didn't include, for example, administrative savings, which are in a different appendix. So that is the way we sought to do it. If there are things that we might do differently in the future, clearly I'm happy to look at that. I'm certainly not intending to do any other further presentational changes or otherwise to the report before it goes to scrutiny. There is limited capacity to do that at this moment in time. But as I say, I'm happy to look at that in the future. But be under no illusion, even if officers are saying, well, we can manage that impact with residents, or there's no real change, that everything is a reduction in an offer of some description, even the ones that you've talked about tonight. If you take a budget away from somebody, they can't spend what they might have spent ordinarily. So there's always a change in offer. Each impact is very small or marginal.
Thank you, Sav. Councillor Rozelle.
Yeah, thank you. I'm just drawn back actually to what Sav said, has told us right at the beginning, is that there is no additional capacity to review what we're looking at tonight. And I think the smart move would be to be, as councillors, really clear on what we need when we ask for it, and then not offer subsequent revisions or questions that mean the work's got to be done again. So there's probably a lesson for everyone here. We need to ask officers the right questions the first time, and then they can come back with the answers that we would expect, presented in the way that we might like them.
Thank you. Councillor Powell.
Thank you. Just for clarity, I wasn't asking for a rewrite of this or anything. As I say, I appreciate the amount of work that's gone into it. I was just emphasising the fact that as members, we have a certain responsibility, and officers have a different role and responsibility. And there's quite a lot of things that, and we can leave officers to get on with the job and give us information, but we need to be clear what actual decisions we're being asked to make.
Thank you. Councillor Rozelle, is that a legacy hand you have? Sav.
I just wanted to be really clear that every proposal in the paper is put forward to members because it's their decision to make, not ours. So, for example, I am reduced, one of our proposals, for tomorrow night, is to reduce the quantum of resource in the finance team. That is a council decision to make because council set the budget. So you might think, well, Saf, that's your decision, isn't it, operationally? It's not. It's your decision to make as a council. That's what you're being asked to do. That's what you do when you set the budget. So none of the decisions, if we could make decisions without reference to members, I would already have made them in quite a lot of cases, but that's not the case. So every decision is for members to make.
Thank you. Councillor Powell?
Sorry, I won't prolong this. And I don't disagree, but I think there is just a difference of and perhaps I'm not expressing myself very well. And but we have to agree a revised budget. Absolutely, that's not an issue. I'm talking about, for instance, that first professional fees, the one about whether you commission bulk services or not, I think is probably a level of detail that members wouldn't need to know. But again, I'm not criticising, and I appreciate the amount of detail. And we do have to make a decision on the revised budget. Normally, we wouldn't get into this much detail, but it's obviously opportune that we do at this moment. So, well, can we just leave it at that? Thank you.
Thank you. Councillor Walters.
Yeah, thank you. Equally, I don't want to prolong this any longer than necessary. I think there's a danger of becoming the Ministry of Administrative Affairs in this item. Everyone is being asked whether or not they support some changes to services which will impact either our residents or in some cases our officers. I think it's really important we take it in that way and determine whether or not we're going to man up and support these changes to services. That's all I have to say, really, Sam.
Thank you, Councillor Walters. Right. Does anyone else have any comments on Appendix B on the sections to do with children's and adults? Obviously, the other sections will be heard by Growth Infrastructure tomorrow evening. So does anyone have anything else with regards to our sections? I'm not seeing any hands. Would it be, in order, before we move on to the future changes, I'm mindful just to keep the housekeeping in order. Could we agree as committees what we were, whether we're happy with the revised offer or of Appendix B and the admin changes in Appendix A, subject to, and I just need to clarify with you, Councillor Waller, your comparison to other LAs. Would you like that to be done with regard to the things in the in-house savings in Appendix B, or was that more to do with moving forward in the longer term?
Excuse me, sorry. It was both, Chairman. So, for example, we were told this evening that the residential for the aiming high the impact was likely to go from 3 residential experiences to 1. Well, I don't know whether 1 is good, bad, or indifferent. And if all the other authorities in the country don't offer any, then perhaps we might consider we're being too generous. If all the other authorities in the country offer 5, then the reverse. So it's just the context of it. And so it does impact on these ones. Not all of them, because some of them quite clearly comparisons are not relevant at this stage. But it definitely is the going forward as well.
Okay, thank you. So, sorry, Councillor Walters, is that a legacy hand you still have up? Thank you. So can I just check then with Jo, if I could ask her to do a thing. Are we broadly happy to accept the changes in Appendix A and B, but with the reviso that we would like some comparison to other LAs, if that's possible, Dawn, moving forward into Cabinet?
I think I need to just have a bit of clarity, a few boundaries around because it's an awful lot of work to do a national comparison with every local authority in terms of each local authority's individual offer. And it's not just about finding out what their offer is. That's published, it's on every website, but it's also about being able to understand the context of the communities that each different local authority serves in comparison, and compare them to the community of Rutland, which will have different needs. Every community has different needs. I think it's actually quite a big piece of work, and so I think I'd like some boundaries around it. If it's about service offer, because every local authority has different budgets, they have access to different grants, for example, depending on their size. They'll have different, they're all different, obviously, we're the smallest, so obviously we have incredibly limited resources compared to every other local authority when it comes to children's services. So I think all of those contexts, it's quite a big piece of work to do a national comparison, if that's what's.
Could we not set a geographical limitation? Would that make things easier?
Well, it's still a very big piece of work, which I think.
I raised it in the first place, and I would have thought comparing local, so that's Lincolnshire, Leicestershire in particular, would be at least more than we've got now. But as well as using the data that's available, I'm well aware that officers meet with their East Midlands Council's colleagues, and it's some of the headline things is something you could raise there, you know, do you still offer, for example, residential experiences under aiming high? So
that's all published. It's already published, though. I think that's the point I'm making. Is so, for example, aiming high is in relation to SEND. Every local authority has a legal duty to publish that publicly on their website. So every local authority publishes a local offer for SEND.
So can I ask then that we look initially at Leicestershire and Lincolnshire and stop there, because that's where our residents are going to be comparing with their mates in Leicestershire and Lincolnshire in the first instance.
So specifically about aiming high residential?
What I said was about all of the services where we have a discretion as to the amount that we offer. But what I would suggest is that the portfolio holders who are all here tonight, they look at it as well, because I'm asking Cabinet to consider it. And I think the portfolio holders are more than capable of actually identifying which specific ones they would like to see the comparisons. I can see Councillor Walters nodding. I can't see the other two just at the moment, but I'm sure they'll be able to do that. And, you know, it's a balance between having enough information and not overloading officers. I certainly wouldn't want to overload, and I would want to trust the Cabinet to ask the right questions.
I shall bring in Councillor Wilby, then I shall bring in Sav, and then Councillor Rozelle.
Just a thought, Chair, that as your scrutiny committee is looking at all these things, would it not be possible for you as a committee to look up the website or where the offers are published for those particular lots and list them? And in that way, you'd be using your time very usefully in providing that comparison.
Thank you. Sav? Sorry, you just put yourself on mute.
To myself, but anyway, sorry, yes. Yeah, I can see how some of that information will be useful. I go back to what I said a moment ago, really, in terms of there's probably a limited opportunity to do any work really before decisions get to Cabinet and Council, I'm afraid. But we will look at it, I think, for certainly some of the longer term projects that we've got, and certainly some of the other things that we're taking forward. In some areas, I can definitely see how comparisons are more useful than others, and I can also see how in some areas it's easier to get comparative data relative to others. There are lots of areas where it is straightforward. There are lots of areas where it's not. So I think making a blanket commitment to give comparative information is not something I think we should do, but I certainly think as we move forward, we should look to try and give that information. My one final challenge on it would be, let's say our offer isn't generous. Let's say we find out that everybody's doing 2 residentials. I would remind members, we've got a £2.5 million gap. You could say to Dawn tonight, for example, don't have any residential offer, Dawn. We need to save £2.5 million, irrespective of what's been done around the patch. But so I'd say it is useful, that comparative information, but it doesn't, but given our challenge, we may have to go further than what others have gone to. We all know the rough deal we get from government funding. We may have to go further. So I just say, you know, I accept the fact it would be useful to get the comparative information, and let's see what we can try and do on that as we move forward. But I wouldn't want members not to challenge and ask us to go further, even if the comparative data said we're already doing quite well. You know, we're already low. We've got to save £2.5 million. We're going to have to go further than lots of others. That's all I would say.
Thanks, Sav. Councillor Waller.
Thank you, Chairman. I totally take Sav's point there, but I feel more comfortable turning around to my residents and saying, I'm sorry, despite what your mate next door gets, you're not going to get it because of our budget, from a position of knowledge. And it's the knowing bit that I want. I'm not advocating saying, oh, well, Leicestershire give X, so we've got to give X as a minimum. That's certainly not the case.
Thank you. I'll let Councillor Rizal come in, but before you do, I will say, because obviously I'm very mindful that I declared an interest and we're swaying into that territory right now. I would say I'm very minded quickly to put this to the vote of the committee soon to decide where once and for all what they want to be, rather than us toing and froing over it. So I'll let Councillor Rizal come in, and then if no other councillors want to speak specifically about this, we'll move it on to vote if we're going to take it forward. So Councillor Rizal.
No, Chair, I give way. Thank you.
Oh, okay. Sorry, Councillor Ainsley.
Yeah, just very briefly, I'm minded that actually if councillors are very concerned about questions being raised by their constituents, there's nothing to stop you going onto the internet and doing a quick Google and actually doing a comparison yourself. And obviously they're going to be presenting figures to you, so you can then say, this is what we're intending to do. So I'm minded to say quite simply that actually if we need that additional information, it's something that we can do either through the scrutiny committees themselves, which I think we're probably going to be hidebound by time and not be able to do them, or the individual councillors can make their own research. That would be my point.
I'll allow Councillor Waller to come back on that point.
Thank you. I'm probably as competent as anyone in doing online research because it was part of my job when I was still employed. However, I am equally conscious of not necessarily having access through the internet to some of the information that officers will have that's generated by government departments, for example. But equally, I have been guilty, and I know some of my colleagues have been guilty, of sending around information that is actually out of date through not noticing it was out of date. And that, excuse me, that's why I'm slightly nervous about doing the work myself. I'd rather have an authoritative view. That was all.
Thank you. Councillor Ainsley, I'm hoping that's a legacy hand, but it is good. I will bring this to a close. So just to do the housekeeping, Appendix A and Appendix B, the revised offer, are we broadly happy with the things going to Cabinet, albeit with regard to CHI 015, if I'm right, Councillor Waller, and we'll move to have a show of hands on this. You would like just some specific comparison information on the offer in the two neighbouring authorities. So Joe, if I could move over to you to put that forward.
Yes, do you want me to take a vote on that, Chair?
Yes, please.
Sorry, okay. Councillor Waller.
For.
Councillor Powell.
For.
Councillor Rizal.
Approve.
Sorry, Councillor Rizal, I didn't catch that.
Sorry, Joe, approve. For.
Councillor Ainsley.
Against, because I'm not happy with the research. Thank you.
Councillor Beggy.
For.
Councillor Fox.
For.
Councillor Bull.
For.
And Councillor Harvey.
For.
Okay. That's passed.
Thank you. So thank you very much, everyone. We will now move on to the Appendix C, D, and E, which involve the future year in-house savings. I'm finding it, the funding changes, and so on. So I will open the floor up in Appendix C to funding changes. Councillor Waller's jumped in first with her hand up, so I'll move to her first.
Thank you. I'm assuming you're taking them all together, these. And one of the points I wanted to raise, and I'll do this one first, is that some of these are clearly places, because they start PLA, that have implications for children and young people, and indeed others. So PLA 018, 019, 020, and 024 are all about bus services and bus provision. And I would hope that as we go forward with those, that the Places Directorate who manages our buses or our bus contracts actually work with the adult services and with children's services, because there are quite significant implications. So, for example, on PLA 019, if we are not supporting post-16 transport, and bear in mind that we are asking parents by and large to pay for this transport or pay towards it, we could be in a position where we have young people who cannot access post-16 education because they cannot afford the full cost, or their parents believe they can't. And I'm not talking about people who are on benefits. I'm talking about those who are on low or lower income, or indeed not necessarily particularly low income, but have got quite large families and so have other childcare related costs. So I'm not saying don't do these things. I'm saying, can we make sure that the People Directorate is very actively involved in this work going forward? And on PLA 020 specifically, can we not look at that one in relation to what is happening in the Leicester hospitals and the changes there? Because one of the mitigating factors that the Hospital Trust and the current, no, not CCG anymore, is it? Anyway, what they've been saying is that there'll be shuttle buses between the different hospitals, and that's fine. Well, that's not fine if you live in Rutland, but the 47 bus that goes from Uppingham to Leicester, if that linked in with these shuttle buses and possibly was subsidised to some degree through health provision to enable that to all happen, then it might be that that service is used more widely because it's used to access the hospital system. And I would like that explored as part of that particular piece of work. I'm not saying it's the answer by any means, but I think it's something that needs looking at. So basically all that is, can we join up? Thank you.
Thank you. I don't know if any, Sav's nodding. I've got John nodding, Sav nodding. I'm looking to portfolio holders to see if they're nodding with me. Karen's nodding. And then I shall bring in Councillor Ainsley, who is on mute.
I thought I'd cured myself, but I obviously haven't. On Appendix C, the hardship fund, I see that hasn't been used for the last 3 years, but I just wondered what the original intention of that fund was. Somebody could answer that question, that'd be great.
Is that page 44, Councillor Ainsley?
It is, yeah. No takers. If we could
sorry, I can answer. I just can't. I can't look at a document, then back on and unmute myself. If there's a pause, a delay. The hardship fund is effectively pays for additional support for council tax support, in effect, and also there's an element of that fund that is actually given to CAB to support those who may be experiencing wider hardship. So, you know, we do things like it might be to give money to tide people over for food, or buy them a washing machine, whatever it might be, anything that might support them in the short term. So we have a hardship fund that supports council tax, but also provides some wider support, which we dispense through CAB, you know, their holistic view of somebody being in hardship, and there's a small fund there that allows them to give people additional temporary support.
Thank you.
Thank you very much, sir.
Did you want to come back on that, Councillor Ainsley?
I don't really have enough, but I'm just slightly, it hasn't been used in the last 3 years, which suggests there isn't a need, but of course these needs come up on an ad hoc basis, and so it just seems perhaps we might want to reduce it as opposed to, or make a recommendation to reduce it rather than abolish it altogether.
No, sorry. There is an amount in the budget for the hardship fund. We also any fund that we don't spend, we put it in an earmark reserve for that same purpose, and that earmark reserve has grown over time because we simply can't spend the money.
Okay. So you're looking to limit the ceiling of the earmark reserve. Is that what you're looking to do?
Yes, basically what we're doing is running down the earmark reserve by funding the hardship fund that's in the budget, as opposed to relying on our general funding for that.
Thank you very much for that explanation. I now fully understand.
Thank you, Sav. Councillor Rozelle.
Yeah, thank you. The question I think is for Sav and possibly John as well. Page 43 talks about the Armed Forces officer funding, which of course was Armed Forces Covenant funding, in truth. With the Armed Forces Covenant coming into statute this year for delivery or for Royal Assent, and then delivery next year. It cuts across every part of society, doesn't it, that service? Now, I believe that the council has always been very proactive in its delivery to children, or education, housing and health. I see that people are concerned about it, but do you think there's going to be significant work that comes with this new legislation?
Do you mind if I take that?
No, please do, John.
No, Councillor Rozelle, all the signs are the initial fears back in September when we first looked at this, and there's quite a lot of speculation as to the burdens it would have on the council were quite substantial. Everything from childcare placements to all sorts of elaborate training schemes, etc., which you know probably better than I do. However, with the recent renditions, can I use that word, of the wording, the suggestion is that it will have a nil burden on us. However, it won't actually be published, as far as we are aware, until August. But the signs are that it's looking good.
Chair, thank you. Thank you, John.
Thank you. Does anyone else have any comments? Councillor Powell.
Thank you. This was a sort of, again, a bit of an overview comment. Obviously, Sav right at the beginning, and we all appreciate that these later, sorry, but I mean, we're talking about D as well here, the strategic projects. The limitation on being able to really get into those is capacity of officers to actually do, you know, which is a lot of major pieces of work. And as I understood it, there will be a discussion at SMT about whether there's a case to bring in, I think it was mentioned, external support, which obviously may be something that's considered by SMT. Could I also ask that they can, and obviously, but there is a lot of capacity involved in actually managing external report and external support and working on the any recommendations. So sometimes that isn't actually necessarily the best way forward. May I also ask that perhaps it's also looked at whether there's a case and whether there's some funding for taking on some, I call it internal support. So somebody employed at a sufficient level who can actually work on some of these strategic projects and really get bedded in and actually do the work, not just make recommendations, as a way of actually, because these are the areas where this, you know, longer term significant savings are likely to be made, and also in terms of the sort of the ways of working. So just suggesting, and I'm sure that's something that's probably on the radar, but just to, again, like the Jules, to sort of front load some of these things, so that, because timing, the more time goes on, the more money we're spending on things that that we can actually make savings by actually speeding up some of the processes on these. Thank you.
Councillor Walters, did you want to come in on that?
Yeah, just briefly, as normal. Yeah, those are perfectly sound ideas, Councillor Powell. I'm sure they are all under consideration. In fact, I know they are. And there is another option, or you may have intimated at it. If we have someone qualified and experienced to do some of this work themselves, of seconding them to do it and then backfilling their position. So everything is under consideration, yes.
Thank you, Councillor Walters. Councillor Waller.
I know this is going to sound like I don't want to make savings, which isn't the case, but I think it's absolutely essential that we have the right staff in the right places to actually undertake these reviews sooner rather than later, because the sooner we can make the savings, the better. And if it means spending now to save next year, or not spending now but not saving for 5 years, then I think we need to go for the former. And I think Cabinet need to be prepared to recommend to Council that where they and senior staff feel it appropriate to invest, and it might be on, you know, 2-year contract or 3-year contract. It doesn't have to be permanent, but I think we ought to be seriously doing that, because you can't make sensible decisions if you haven't got the people to do the work in the first place. Thank you.
Thank you. I don't know if anybody wants to make comment on that. If not, I did have one question to, this will probably be to you, John. On page 53, ADU 009, the daycare review. It was just clarity actually on what this was meant, because I wasn't sure, and Councillor Waller and myself did have a conversation. We both thought this was two different things. So just clarity, because I wasn't sure whether this was the thing that used to run out of RMH, the day centre at our the Rutland Memorial Hospital some years back, or whether it was in fact the contract that was dotted around the county. So just some clarity on what the daycare review at the Rutland Care Village kind of was and looks like currently.
Okay, we contract with the Rutland Care Village for an older people's day centre, which because of COVID has been closed, and that contract is coming up for renewal. without getting too specific, councillors, as we have done with Right Ways, of looking at it in a very different way, and have made some positive changes that have gone down very well with our service users and their families, and has produced some savings, perhaps in other areas rather than my own, but that has happened particularly around transport. There's an opportunity here that we can work in a different way, and I actually have some officers working on this at the moment, but specifically it's for the older people's rather than learning disabilities.
Yeah.
I don't know anything about RMH, so that's perhaps a bit before my time.
Yeah, no, it was just I know, and I'm going back about 10 years, maybe a bit longer, that they used to have a day centre where some of our elderly residents would be transported in and have. I'm looking to Councillor Ball here for hoping he can enlighten as well. And so I didn't know whether it was that service that had been recontracted under the Rutland Care Village. That was where I thought, but Councillor Waller thought it was something else. So I'm going to move over to Councillor Ball, who will hopefully give us some history.
Yeah, you are quite right, Chairman. There were the various day centres set up in and around the county. There was, in fact, one at Cottesmore, but that I think was the last one to close. But that was funded from within the resources available at that time, and it was one of those necessary cost savings some while ago, prior to certainly, you know, well, going back how many years, 6, 7, 8 years, when that was finally back when actually Roger Beggy was leader. So it does go back some years actually, but the principle of what you're saying is right, but unfortunately that facility was removed some while ago.
Thank you. Councillor Rozelle.
Chair, it's just a very brief comment. I keep going back to the very, very clear advice we had from SAV. Now is not a time for us to start looking to create more work or spend more money. I suppose what I've looked at and listened to intently is the degree of detail in which officers have gone into the work that they deliver. And quite clearly, it's been many, many hours of activity. So I'd like to put on record that I trust them. I don't want to question what they've said at the moment. They've been asked to join us in making some difficult decisions. They have my support.
Thank you. Councillor Payne.
Just to say that in Appendix C, that list of projects for further consideration, we will be looking at how we resource those, and that's why SAV has asked for the 500k. You may remember that he referred to at the beginning of the conversation. The work hasn't been done yet, but obviously when we go through the list with the SMT, we'll be picking off the quicker wins first, and leaving the more difficult stuff till the last. That doesn't give us so much benefit. So it will be under consideration, is what I'm saying.
Thank you, Councillor Payne. Councillor Rozelle, do you have a legacy hand up, or do I have any other comments from any other members? I'm looking around the room. Oh, Councillor Fox.
I would just like to thank Sav and the team for all the hard work that they've actually put in. We asked him to look at our budget line by line, and that is exactly what him and the team have done. And I really do thank him for all the work that he's done. This report is very clear with adults and health and children's and also GIR. And I really would like to thank him for all of his hard work. That's all.
Well,
thank you, Councillor Fox, and I think the rest of the panel also joining you in thanking Sav and the team for that. Sav.
yeah, it's the team, isn't it? I mean, I haven't done a lot, but every manager has worked with the directors to go through everything. So it's, you know, we balance, pull stuff together, but all the work is done by everybody else, really.
Thank you. So I'm looking to the rest of rest of the panel, it does look like the debate's coming to a close, and I know everyone's got a massive long night again tomorrow. Some of the officers are coming back, so if everyone else is in agreement, I think we should begin to draw the meeting to a close. I'm looking for nods from the rest of the team. Everyone's in agreement. I'll just check my housekeeping with Joe that we have actually passed what we needed to pass, and we've agreed to what we needed to agree to for everything to go to cabinet and things. Thank you.
Yeah.
So if did I hit no? If there is no further questions, I shall declare the meeting closed at 20:34, and I would thank officers and councillors for their work.
Thank you, Chair.
Thank you. Thanks.
Thank you.
Night.
Bye.
Thank you. Good night, everyone.
Thank you, everybody. Bye.
Bye.